Hey, it's Dr. Centeno, and this is my series on craniocervical instability measurements and how to do them properly. So this was actually an interesting case because this is a patient in an upright MRI in flexion, and we're measuring the clivoaxial angle here. And the purpose of this is try to see if there's too much stretch on the spinal cord and medulla. And if it's closer to 120, that's a concern. If it's really anything over 125 to 130, it's not a concern. So the problem was that the reading radiologist put this cursor way back here and came up with a clivoaxial angle of 124 approximately. Now, the 124 reading was a concern, and the physician that sent this patient to that imaging center thought that this patient had a very low clivoaxial angle and consequently craniocervical instability in flexion. Now, the problem is that you're supposed to place this portion of the clivoaxial angle at the posterior inferior corner of C2, or the dens, but it's got to map along the bone. And as you can see here, it's very hard to see where the bone starts. You've got a little bit of soft tissue back here and a little bit of pannus. So the actual placement for this portion should go about right there, right where the bony cortex ends, and then along the clivus here. So now we're at around a 130, which is a normal clivoaxial angle with normal stretch on the medulla and spinal cord. So I really encourage you, if you've got a craniocervical instability patient, you get an anomalous reading from a radiologist, to double check that reading, or I'm happy to take a look at it as well. Just send me an email and I'll do the measurements myself. But it's not uncommon, since radiologists don't do these measurements all that often, for them to get them wrong. So again, double check this stuff. Thanks so much for watching and have a great day.